Hello, everybody. Today we have the very awesome Paul Kolodzik on the podcast. I got your name right, Paul. And
Yeah.
we are going to have a fascinating conversation about continuous blood glucose monitors, something you guys know I've been speaking a lot about recently, how it influences hormones, of course, body weight, because everyone wants to know that. But Paul, quick intro. Paul is best-selling author and he is an expert on continuous blood glucose monitoring. That's why I wanted to have you on the show, Paul. You have a lot of experience. You're a medical doctor, but you also use glucose monitors to not only help your clients with weight loss, and maybe if we've time, we could get into the aspect of what other treatments you're using for weight loss, but also optimizing their health. And when I spoke to you, I said, would you like to talk about hormones? And here we are. So, how are you
All
today,
right.
Paul?
I'm doing great. Thanks for having me on.
So, you've been a medical doctor for quite some time now. What made you get interested in CGMs? Like, where did that transition happen?
So my background's in emergency medicine. So I've worked in emergency departments for coming on 30 years now. And what gets all the press in the emergency departments is, the overdoses and the traumas, the assaults, that type of thing. But what emergency physicians, no matter what country you're in, see every day in and day out, are the vascular problems that is associated with high blood glucose and then associated obesity issues. So it's really, the diabetic emergencies and the peripheral vascular disease, the blood vessel issues that arise from high blood sugar, heart attacks, strokes, kidney failure, et cetera. And so after seeing that for several decades, I realized that rather than be reactionary to those problems, once patients come in the emergency department, it'd be nice to help people avoid those problems. And really, when I talk about those problems, it really begins with blood glucose and then secondarily obesity or being overweight. And a large number of these cases are preventable. People go on to have diabetes and the complications of diabetes, but that is preventable for a majority of people. And it's just really a little bit of knowledge that can help people get pushed in the right direction to avoid those complications. And that's why I opened my metabolic health clinic about 7 years ago to focus on helping people lower blood sugar, lose weight, reverse prediabetes, get off medications if you're a diabetic, and inhibit the potential complications of those problems.
hmm And if you don't mind, I might add your clinic practices in helping people find their lives and their happiness again. Because we're not just talking about health in the physiological sense, this has a huge ripple effect.
Absolutely. I mean, if you're in control of your health and you feel empowered to manage your future, then that, of course, can have impact on your psychological outlook, and your mental disposition as well. So, yeah, it's the whole package that matters.
So not many women know that cardiovascular disease is the number one killer of women, and cancer is now fast approaching on being number one. And when I was growing up in Dublin, we always thought of cardiovascular disease or stroke or anything was going to be more male dominant. Your granddad or your uncle would have a stroke or cardiovascular issues, but that's not where the research is. It's women. And that of course makes me consider, well, is it the hormones, is it the stress, perimenopause, all that? But we would be so naive to think that nutrition and lifestyle do not play a part in that.
Oh, absolutely a huge part. And unfortunately, over the last 30 years, this is my belief, my opinion, after a career in the emergency department, spending time with patients in my metabolic health clinic, is that we have this huge focus on cholesterol.
Mm.
Cholesterol is kind of the be all and end all, and you have to keep your cholesterol low. And I believe in cholesterol. It's not that I don't believe in cholesterol, but for the majority of people, 60% in the States, 60% of adults are overweight, 30% are pre-diabetic, and another 15% are diabetic. So for the majority of people, it's the inflammation to the blood vessel linings caused by high blood sugar that I believe play a much bigger role. And, I have patients come to me that have high cholesterol, and I'll at times send them to a lipid expert, a cholesterol expert. So we do want to control that whenever possible. But blood sugar causes inflammation to these blood vessel linings as well. And I think for a majority of people, because of the preponderance of diabetes and prediabetes, it really can play a larger role. So it's a focus there, and this is important because there is this exchange between your diet, because lower carb diets, which help control blood sugar, which I'm a big believer in, have a tendency to be a little bit higher in fat. And
Mhm.
of course, we've been told by the pharmaceutical industry and the medical industry and the food processing industry for the last 50 years, really, ever since the food pyramid came out, that you have to decrease your fat intake. You have to be a hawk related to watching your fat intake. But what has happened over that period of time? Well,
Yes.
we were told that we can eat more carbs because carbs were safer than fat. And what has happened since the 70s is the epidemics of diabetes and obesity. So there is a balance here, and I think there needs to be a much greater emphasis on controlling blood sugar to avoid these long-term blood vessel problems, as you mentioned, even cardiovascular disease. And and having worked in the emergency department, what you said, I just want to mention this for a second. What you said is absolutely true. If you're a 73-year-old man and you're overweight and you come in with chest pain, obviously there's a focus there. And we pay attention to chest pain in women, but the signs can be a little bit more subtle.
Hmm.
The signs of a heart attack, for example, could be fatigue or lightheadedness or mild shortness of breath. So, as an emergency physician, I really have to have my radar up related to those potential issues in females because they can be often overlooked because you're right. The focus is male dominated there because we think that cardiovascular disease can be primarily men,
Hmm.
but that's not the case.
Mm. There's a lot to unpack there. Firstly, with the cholesterol aspect, if cholesterol is high, there's something else going on there. There's some metabolic dysfunction there. I believe in 2020, if I'm correct, the FDA did release a statement kind of under the radar that dietary cholesterol does not directly influence serum cholesterol, but yet, the other day, I was speaking to a woman. My doctor said to reduce my cholesterol in my diet. I'm like, I'm pretty blunt. I'm Irish. I'm like, your doctor doesn't know what he's talking about. Like, seriously. And then I like that you said balance, because balance is something I really emphasize in my work. We were told to eat lots of whole grains and carbs. And then we were also told to eat lots of fat. And whether or not people went over the top with that, nothing seems to be working because regardless of what we seem to try, the last one I'm in Canada 11 years and in the health industry 20, and there's always been some sort of trend somewhere. But no matter what we try, we're just getting worse and worse and worse. Something else is going on there. And I do think, I spoke to a woman about this morning. I do think continuous glucose monitors, they're a very valuable tool. I'm sure you'll agree, and I did post research on this in one of my groups that basically stated the more educated a patient or a client is on whatever dietary protocol they're following, the more inclined they are to stick to it. So education is key. And sometimes the education needs to be very simple, like how many steps are you getting in? What does your blood glucose monitor say? Because I think that data is really simple. You look at it, you see a spike, you don't see a spike. It's very visual and very eye-opening, I think.
Absolutely. People getting a CGM on, I think, can be eye-opening because their doctor could be telling them for years that, you need to watch your diet, you need to move more. The typical approach is the doctor says, eat less and move more. Well, yeah, that's maybe not that easy to do. But once you see the data on a CGM and you see those spikes for yourself, it can be very motivating. I have many patients that come in and we put a CGM on, and the protocol that I follow is I ask them not to change their diet for a
Mhm.
week. Don't change your diet. Let's just see where you've been living in terms of what's going on with your blood sugar. And a lot of patients come to me and they want to lose, 15, 20, 30 pounds, and that's the agenda. But once they have a CGM on and they see spikes, I've had patients that didn't think they had any blood sugar problem. They see a spike and they're spiking to 230, 240. They've blown through being pre-diabetic. They're already diabetic. And once you see that data yourself, it can be empowering because you're receiving data and you have the opportunity to act on it. So we go through this diagnostic phase, which is don't change your diet, use the CGM for a couple of weeks. We do other things we can get into, like do a fasting insulin level. And I'll show you my bias again. I believe a fasting insulin level to determine your level of insulin resistance can be more important than a cholesterol level for many people. And then once we know where they are with that baseline data, then we can build a program that looks at, for most people, decreasing insulin resistance, which of course helps with weight loss.
Mhm. So I don't know if you could see it.
Oh, yeah, there you go. All right.
I've been wearing one for a month now. Actually, tonight it expires tonight. So I don't know if you have
Yeah.
that there. We have a Libra one, so it's not the
Yeah.
best comment. So, but I was speaking back to that client this morning. She's like, Shemaine, I've started having hot flashes, and I'm like, okay, we haven't spoken in a while. What's your nutrition like? And um she just so happened to mention she was having cookies and milk in the evening, and I was like, I would put
Yeah.
money on it that that's what's causing your hot flashes at night. Most women want to blame hormones, but a huge factor in hot flashes and night sweats is blood sugars and adrenaline. Although
Yeah.
people are like, it's my hormones, I'm like, it's not. So I said to her, like, go get yourself a CGM today. Wear it now for the next while, and I think you'll be quite surprised at what you see. And she just happened to say in passing, actually, yeah, this only started happening once I started the cookies. Like,
Yeah.
sometimes
Yeah.
we're just completely kidding ourselves. Like the answer is right there. But just back to mine. Because you were saying we're looking at the spikes, but we're also looking at how fast it comes back down too. For me, I'm very muscular, athletic, I exercise a lot. So even if I do get a spike, it's back down within like 20 minutes. Like I come down really fast, which is
Yeah.
great. Um, but I
And the
started,
reason, can I
Oh, go
the
ahead.
reason for that is because you've increased your muscle mass. This is why I'm a big proponent of strength training for people that have insulin resistance as well. The reason for that is you've increased your muscle mass. When you increase your muscle mass, you increase the quality, number, and receptivity of the insulin receptors on your muscles, largest organ in your body. So you're soaking up more insulin, you're soaking up more blood glucose, and that helps stabilize your blood glucose. So that's how strength training integrates with this issue of insulin resistance and blood glucose variability.
Yeah, absolutely. Absolutely. If I have a big sugar spike from actually sweet potato spikes me a lot, which sucks because I love sweet potato. But if I go do some air squats or something, especially leg exercises, I can bring it back down. But if I sit around doing nothing, it won't come back down, which I want to just follow on for people's education purposes because I am the anomaly in the aspect of the general population in that I just had a 2 hour weight training session. Like I train hard, and most people don't do that.
Yeah,
But
right.
um, 3 weeks ago, I think I w was on vacation in Idaho, and I do a lot of walking on vacation. I really try to just give my body that break. And Paul, I swear, and I don't eat like other people. I'll still make good choices. I still have my berberine. I still have my apple cider vinegar. I'm doing all the stuff. My blood sugars were insane because I wasn't exercising. It wasn't coming back down. I was getting bigger spikes. I was just out of range. I was basically pre-diabetic for those 5 or 6 days I was on vacation, and that was really eye-opening for me. Otherwise, I don't know if you understand our measurements, but otherwise my A1C is 5.3. I'm like below most people
Yeah.
because it was vacation. I don't even drink a lot. I just was not exercising the way I normally do. And that
Yeah.
change was extreme, and that was very eye-opening for me.
Yeah, yeah. The three legs of the stool that we use for our patients in terms of reversing insulin resistance are I'm a low carb diet proponent. And again, there's this balance between fat intake and carb intake, again, because if your carbs are lower, your fat's going to be a little bit higher. And we can get into this whole issue of good fats and bad fats, and even come back to your issue of how much of blood cholesterol is impacted by dietary cholesterol. It's very little, as you just mentioned. But the three legs of the stool that we look at is making sure people are low carb, get adequate protein because you're going to be strength training. You got to get the protein in. Low carb with adequate protein. And then it's some intermittent fasting, which we can talk about. And then, of course, the strength training component to decrease insulin
Mm.
resistance.
Yeah. But what was interesting to me that although I'm very muscular, because my muscles weren't getting that signal, they weren't getting utilized,
Yeah.
activated. I wasn't
Yeah.
uptaking the sugar the same way as I used to in my younger years because I had wore
Yeah.
a CGM 2 years ago, I think maybe a year and a half. Again, just out of curiosity
Yeah.
purposes and
Right. Yeah.
totally different.
Well, insulin resistance gets a little bit worse as we age, inevitably. Even in thin people, if you live into your 80s or 90s, you're going to have some insulin resistance. So it's important to be aware of that, and it is important to do the things you can maximize to inhibit that insulin resistance. So again, you actually learn firsthand how your strength training can impact that.
And that's the perfect segue because that's what I wanted to talk to you about. Because as I'm entering now perimenopause, my hormones are changing. And exactly what you said, most women and men, but women especially in this context, don't realize that no matter what, all of us, none of us are exempt, that the older we get, the more insulin resistant we become. So then I had to start getting some night sweats, and I was like, what the hell is going on here? So I was curious to see what my blood sugars were doing and if I was going hypoglycemic at night or something, and that was what was causing the vasomotor changes. So that's kind of what
Yeah.
encouraged me to say. And I wanted to see, well, now that I'm older, how is my insulin changing? So it was really an education source for me. It turns out, though, that it wasn't the blood sugars that were causing my night sweats, it was stress. So again, to that
Good.
adrenaline. But let's discuss this for a bit. Most women don't know that as they get older, doesn't matter who you are, like you said, the slimmest person in the world, we do become more insulin resistant because of those hormonal changes.
Right. So when you have a decreased estrogen output, which is what happens with menopause, the perimenopausal period, that increases insulin resistance directly. And can we talk for a second just about what insulin resistance is, physiologically, what happens? So this is the model that I like to talk about with my patients, is that if your blood sugar is stable and relatively low, then your body is going to be using blood sugar as a primary source of energy. But if your blood sugar is higher for a period of time, and large percentage, nearly 50% of people in the States at least, that have excessive carb intake and are overweight and at risk for prediabetes and diabetes, then what happens is your blood sugar is higher for a period of time. So insulin is released when you eat a carb. Is released from the pancreas, and that is the signal and the lock to open up those entry pathways of blood sugar into your organs. So that provides contraction energy for contraction, for example, with your muscles. And so far, so good. But if your blood sugar is high for a period of time, then insulin keeps getting pumped out from the pancreas. And after a while, those organs have enough blood sugar. There's enough blood sugar in the blood, there's enough stored blood sugar in the organs called glycogen. And after a while, those organs, like your muscles, stop listening to the signal from insulin because they have plenty of energy. And that's the way I like to explain to my patients. That's what insulin resistance is. It's essentially those organs saying, insulin, we aren't going to listen to you anymore. We have all the energy we need. So we aren't going to listen to the signal from insulin. That's insulin resistance. So what happens then? Well, that excess blood sugar can become toxic. So something has to happen to it. Well, it goes to the liver and gets converted to fat and then deposited around the middle as visceral fat, which of course is the most unhealthy type of fat, as we all know. Some of it will stay in the liver, causing a problem called fatty liver disease, which I'm sure you've talked about in the past. So, in order to reverse that process, you got to lower your blood sugar a bit. And that's why I'm such a big advocate of low carb diets and continuous glucose monitors to guide low carb diets. So, you lower your blood sugar, and after a while, those organs, instead of having too much blood sugar, they realize there's not as much blood sugar around there and they're looking for another source of energy. What's that source of energy going to be? It's going to be that visceral fat around the middle. So that's when fat starts getting broken down and used as a source of energy. If you carry that to an aggressive extent, that's what a keto diet is, because fat breakdown produces what's called keto bodies. And that's really the reason for the keto diets being named that. I usually don't push my patients that low. I usually keep them in a low carb, but not a ketotic range. But that's enough to break down that visceral fat, which eventually results in weight loss and improved health.
Mhm. And just to elaborate on that, if the for people listening, if the insulin is chronically high, like all the time, we're not talking about, oh, you get high insulin for one day. Like this is usually people's lifestyle. It's a poor lifestyle. It's chronically
Yeah,
high, the cells become desensitized, and that's where the
yeah.
problem is.
Yeah, yeah, and after a long time, if your pancreas is just still kicking out all that insulin, the beta cells in your pancreas can burn out then and not produce enough insulin, and of course that results in diabetes.
And you can get
So
fatty pancreas as well. Most people don't know you can get a fatty pancreas.
yeah, yeah, right, and pancreatitis and pancreas necrosis related to that as well. So the bottom line is you want to keep sugar at a relatively stable range. And that's why CGMs are great because you can monitor what level you're at and you can monitor this variability that occurs as well.
Yeah.
So, and then in addition to just increasing insulin resistance, decreased estrogen can also regulate the amount of glycogen release from your muscles. So, it can actually result in decreased estrogen can result in an increased amount of release of that blood glucose from your muscles and your liver into your system, raising your blood glucose as well. And so, this combination of some decreased insulin release, regulation of the glycogen, and then an increase in sensitivity, is kind of a triple play on, increasing the amount of fat in your body. And that's why the hormonal changes during the perimenopausal period with decreased estrogen can be such a challenge for some women.
And also excess estrogen, because excess estrogen directly influences metabolism as well. So it's back to what we were saying about balance, and that's CGM can help a woman find balance because one woman might be low on estrogen, but another woman has estrogen dominance. So we can't be giving everyone the same plan. Again, CGM is going to tell you, like, okay, Shemaine can't have sweet potatoes, but the woman next to me might have no issues with sweet potatoes. So we're not going to give them the same plan.
And that's what's so great about a CGM. You get to see how the different foods you eat cause changes in your body related to your blood sugar metabolism. And there are nuances to this. Everybody is not the same. So you can learn what foods are most damaging to you in terms of raising your blood sugar and which foods you can get away with eating without having a significant blood sugar metabolism issue. Can we talk about the insulin issue for just a second in terms of evaluating insulin? So I do a fasting insulin level on every one of my patients. Again, I think it can be more important than cholesterol for a number of patients. If you obtain a fasting insulin level and you obtain a simultaneous blood glucose, then there's a relationship between the two because if your insulin's a little bit high, it should be pushing that blood sugar down again because insulin is the signal to push that blood sugar into your organs. So a little bit of a high insulin should be lowering your blood sugar. But if you draw a fasting, simultaneous fasting insulin level and fasting blood sugar level, you can see the relationship of the two. And you can plug that into a formula. The acronym is HOMA-IR, HOMA-IR. It's the acronym for a fancy term called homeostatic model of insulin resistance. And you can drill down to an exact level of insulin resistance for that individual. And I do that in all my patients. So the combination of that piece of data and absolute level of insulin resistance and then their CGM patterns can be just excessively valuable in terms of helping to put a program together to stabilize blood sugar and to help people lose weight.
Mhm. Unfortunately, in Canada, fasting insulin is not the standard. Like
Yeah.
in my
Yeah.
practice, I look at a lot of bloods, and I've maybe seen fasting insulin twice. So one, if you want it, you pay out of pocket. But
Yeah.
two, you have to beg and plead, and even then most doctors say no. So the only time I've seen it is if someone has gone to a functional medicine doctor and they've
Right.
been willing to do. And homa IR, like, what's that? I don't think that even exists in Canada because they never do that. And this is the challenge, that if you're not getting this help from your medical doctor, well, you can go into a pharmacy and over the counter buy yourself a CGM.
Right. Yeah, you don't need a prescription. Basically, it's empowering for individuals. And I want to let you know the Canadians are not alone in terms of the lack of focus on a fasting insulin level, because that's true here in the States. People will get cholesterol levels 3 or 4 times a year and never get a fasting insulin level when it can be much more valuable. And people have to ask their doctor for it here. Sometimes those docs will oblige and sometimes that they won't. There's a cost if you go out and get it on your own. I've looked into this in the States, and you can actually order a fasting insulin level from a national laboratory group called Quest. I don't know if you have Quest Labs up in Canada or not,
We do,
but
but we're
they have.
limited on what we can get from them.
Yeah, yeah. So, but I'll tell you, in the States, there is an order your own insulin level, and maybe in Canada that's applicable too. There's a cost. It does cost $100. I'm sensitive to those costs for my patients. But again, I think that the value that you can gain from that, I mean, at times it can be life saving because I've had patients that they're on the edge of prediabetes. And again, I'm not sure how it is up there, but a lot of times in the States, the can just gets kicked down the road. The primary care doctors are busy, and they've got their eyes and their fingers in their computer, and they're documenting all these variables, usually for billing reasons, so you can justify the visit. And that they aren't really focusing on some of these other things that we think, well, that can be real important, like insulin resistance. And rather than just saying, eat less and move more, what specifically do you want me to do, doc, related to that?
Well, look, if these doctors were taking action here, I probably wouldn't be in business. It's the truth
Oh,
of it.
there you go. There you go. That's
And
that's
there is
true.
a cost
Yeah.
because even here, and I do have a following in the States, and a lot of my clients have second homes down the States. So, like, where there's a will,
Yeah.
there's a way. Even here,
Yeah.
though, lately I've been talking about getting access to bioidentical hormones and therapies and thyroid and even certain tests. And it comes to a stage where you just have to bite the bullet and accept I need to take responsibility. And if it means I have to pay out of pocket to get some answers, so be it. Like, and it is what it is. And I say all the time, if I could prescribe and if I could do everything for free, I would. I think people know that, but I can't. So we got to
Yeah.
suck it up.
Well, and I think you're right. Nobody cares more about your health than you do individually. I mean, your doctor hopefully has your best interest in mind, but they got all those competing issues, vying for their attention, a busy schedule, the next patient that they have to see in a few minutes, the amount of documentation they have to do in the medical records. So, people have to take responsibility for themselves and take control of themselves. And that's again why CGMs can be so empowering, because you get a handle on the data yourself. So, one thing that I hope comes out of this discussion is that people realize that they are empowered to be able to manage their own health future. And nobody's going to care more about that than they are. So it's a matter really of just rolling up your sleeves. And I'm gratified that I've had all kinds of patients over the years that just decided it was time that they were going to take it into their own hands. That they were quite honestly tired of being at the mercy of the medical establishment or the pharmaceutical industry or the food processing industry, and said, hey, I'm just going to manage this myself. So they sought out data, sought out a practitioner that was going to help them with that process, and they changed their lives. And that's one reason I'm in this game, is because it's very, very satisfying when you see people that really can turn things around. I've had young patients, both parents diabetic, they're overweight as teenagers, and once they see the data, the young people are so data driven. Once they see the data, they turn things around. And it's not like turn things around for a few months, it's turn things around for a lifetime. And
Mm.
that can be very
Yeah, because
gratifying.
you feel good and you want to keep that going. And
Yeah.
like you mentioned, like everything can be undone. The question is, how badly do you want it, though, that you're gonna take that action? Now, I wasn't going to go here, but I'm going to go here because you
All right.
said they kicked the can down the road in regards to what are they doing cholesterol. Well, let's see if it gets worse. Let's just wait it out.
Yeah.
Well, actually, now I know you have experience in this area, so let's go here because it's a hot topic and it'll help the
Yeah.
algorithm.
I think I know what's coming here.
What doctors now are doing, no questions asked at all. Here you go. Here's 10 injections. Is they're immediately moving literally everyone I know onto Ozempic, semaglutide. Like, I know you have experience in this, so let's go.
Yeah. Let's talk about it. Yeah. So these medicines, let's do a little background on these medicines. They were first prescribed to diabetics because they're good at blood sugar control. And what they're good at doing is preventing high blood sugars, but not bottoming blood sugars out into the hypoglycemic range. So the pharmaceutical companies that develop these medications, and we're primarily talking about Ozempic and Wegovy, both the exact same medicine, or by the other pharmaceutical firm, it is Zepbound and Monjuro. Those are all the exact same. They aren't all four the exact same medicines, but they're paired. Ozempic and Wegovy are the same, and Monjuro and Zepbound are the same. So the pharmaceutical companies saw that people lost weight on those medications. It was prescribed for blood sugar control, but people lost weight. So they went back and did additional studies, because these medications don't bottom out your blood sugar very frequently, only rarely. And so they got approval for weight loss. And then, of course, the cat was out of the bag, the genie was out of the bottle, their use took off. The genie is not going back in the bottle. People are going to use these medications going forward. Unfortunately, right now, there's a lot of internet access to these medications. This is my belief. And there's a model out there of getting patients on the medications and keeping them on the medications indefinitely. And of course, that's the approach the pharmaceutical companies would like, because they want this to be a chronic management thing where, you start a medicine like you do for blood pressure and maybe be on it for decades. Um, my belief is that because people want these medications and are going to use these medications, when somebody comes to me and they start asking about these medications, then my approach is the term I use, I stole from Stephen Covey of the 7 Habits of Highly Effective People, which is begin with the end in mind. And is the end in mind, hopefully, is that you are not going to be on these medications lifelong dependency. So what we look at, I look at an approach of what I call microdosing, where you want to use lower doses for limited periods of time. So I'll use the first and second tier of dosing to help people with these other lifestyle issues, the intermittent fasting, the low carb approach, and the strength training. And we can get into this. Of course, you know this. You got to be on these you got to be strength training if you're on one of these medications and getting adequate protein because you aren't only losing fat, you're losing muscle as well.
Mhm.
So I do treat patients with these medications. Quite honestly, one reason is because I don't want them to go somewhere else where they're just going to get a shot and say good luck. I really believe this needs to be lower doses for limited periods of time as part of a comprehensive program.
Yeah. And you're also using the CGM at the same time to help them see that data, the changes that are happening with the Ozempic, potential changes that are happening with the Ozempic.
Yeah, so the way I do this ideally is we go through a CGM trial, a couple week trial, people wearing a CGM, they get to see where they live. We do the fasting insulin level. You can institute the medicine at that point. I either do it as a jump start or if somebody's been on my CGM program for a number of months and they get a stall, then they might want to look at starting the medication. But what you want to do is keep those doses low for limited periods of time. So you're going to use a CGM at the beginning of this process to get a good baseline. And then as you start titrating down and off the medicine, you want to use one as well because that will be a guideline to you to be able to titrate down and off the medicine without the significant weight regain that can occur when you go off the medications.
Mhm. But again, you're also doing the nutrition and lifestyle practices, which you said it yourself, you'd rather prescribe than send them somewhere else where doctors are. They're not. They're just not. And here, all I see is titration up. They're not titrating down. And they're
Yeah,
saying, okay, watch your nutrition. Goodbye. There's no
yeah,
follow-up. There's no referral. Go to this nutrition therapist. Go to this personal
right.
trainer. They're not referring out either. So people are just going home and, oh, my doctor says I have to eat better and walk more. But let's be completely honest, Paul. How many
Yeah,
people are doing that? Like, really?
right. And yeah, it's human nature to just grab the magic pill as best you can, but it's not in people's best interest. Again, I don't know what your situation is up there, but you know, a minority of people are covered for weight loss by these medications in the state from an insurance standpoint. So there's a financial burden associated with this. And if you can keep the doses lower and you can use the medicine for a limited period of time, you can help people manage through that challenge as well. So again, lower doses, limited periods of time, titrate up to a low or moderate level, not an absolutely high level. Now, unfortunately, as I mentioned, there is a group of providers out there that just want to get you on the medicine and keep a patient for life. So that's, you know, not ethical, but it's happening. So
Hmm.
if people look at doing this, they should look at it doing it as part of a comprehensive program and hopefully for a limited period of time. And I'm going to actually just give you the pillars again of what we do. Now, there's a lot of detail that you can get into this, but let's talk about carbohydrate intake. What I tell my patients initially is we want to keep your carbs generally in the 35 to 50 gram range. I know if you're weight training, you're looking at probably a lot more than that. But I'm talking about my patients that need to lose weight. We look at, you know, 50 grams or less. We're making sure they're getting adequate protein. You know, I know there are formulas to determine that amount, but I want to make sure they get at least 100 grams of protein a day, maybe up to 120 or so, which can be very tough if you're on one of these medications because you don't feel like eating that amount of protein. And then I initially say, let's not worry about the fat so much. Now we'll get into good fats and bad fats over a period of time. But let's initially, you know, I don't want to overload people. Let's keep the carbs low. Let's keep the protein high. If you got a cholesterol problem, before you jump on a statin, you know, a medication to lower cholesterol, you know, I recommend all my patients, you know, there should not be a knee jerk. Your cholesterol's high, you have to go on a statin. There are nuances to the type of high cholesterol you might have in terms of what are called LDL subunits, because you can have a high cholesterol with favorable subunits and not be at risk at all, or you can have the harmful subunits, which are an issue. So we look at LDL subfractions as well. So that's the dietary component. And then intermittent fasting, I think, is an easy way to help lower your insulin resistance as well. Second best approach, other than keeping your carbs low. And so
If
we look at
anything, if
intermittent.
you don't mind me adding in, Paul, just for your
Yeah,
listeners, if anything, intermittent fasting, and always within context on the individual, but it gives people structure instead of people just having a
absolutely.
free for all. And it does
Right.
prevent a lot of people from eating in the evening, which is our most problematic time.
Yes.
So, regardless of
Yeah.
everything else we think of intermittent fasting, it at least is giving us some like rules on where we should and shouldn't do things.
Yeah, yeah. My patients tell me that the intermittent fasting they undertake is probably the easiest thing they do related to this once they get into routine. And when I'm talking intermittent fasting, I'm usually talking about 14 or 16 hours overnight. I'm not saying you need to fast for 3 days at a time. 14 or 16 hours overnight. And then if you got something special going on with your family, a special dinner in the evening, breakfast on a weekend, that's fine. You don't have to keep that pattern. Live your life and enjoy it. But in general, maybe 14 to 16 hours fasting. So basically, it's the macronutrient component, the fasting, and then the third pillar of the approach is the strength training.
Or move even. Most people don't move as much as they think they're moving at all.
Yeah,
Most
yeah.
people are
But
delusional. I get a lot of my clients to wear a pedometer because unfortunately the
yeah,
wearables are not accurate. Even the Aura Ring is not accurate when it comes to steps. So I'll just get them to buy
yeah,
a cheap pedometer, and that is very eye-opening as well because they
yeah,
thought they were getting loads of steps. And no, you're not.
yeah, yeah. So let's talk about that breakdown for a second, if we can, because we all have just so much time. Admire you for a 2 hour workout. In my practice, I would say most people that are busy with jobs and families, they're willing to devote 4 to 6 hours a week to working out or
Mhm.
so. Um, so what should that breakdown be between cardiovascular and strength training? I'm a big advocate of strength training for my patients. For the women, this is, of course, very important because of the risk of osteoporosis as you get older, and that's related to your degree of muscle mass. Almost 30 years in the emergency department, I see a lot of frail people without muscle mass as they get into their 80s, 70s, sometimes even 60s. I see people that lose their mobility, not because they got a neurological problem or a joint problem or a back problem, but just because they don't have enough lower extremity muscle strength
Mhm.
to get up and get around. So I put a big emphasis on strength training, big emphasis on leg day for that mobility reason. So the breakdown that I use is this. I don't follow the American Heart Association for everything, but the American Heart Association says that people need to get to, 80 to 85% of their maximum heart rate for 75 minutes a week. Or if you want to go the 65% range, it was for 150 minutes a week. But if you think about that, if you can get your heart rate up to 85% of your max and the clock doesn't start until you're at that 80 or 85% of your max, do that for 75 minutes a week. I personally do it in 3 25-minute sessions. That means I spend an hour and 15 minutes a week on cardiovascular. Why do I feel that's a good thing? Because I'm like other people, only have 5 or 6 hours a week to work out. And I can spend 3/4 of my time on strength training. We're losing 7% of our muscle mass or more per decade once we hit 35 or so. So, really, I think strength training is where it's at, especially important in women because of the osteoporosis issue, and especially important in anybody that's going to go on these GLP-1 medications, because you're going to be losing muscle mass and you got to do everything you can in terms of workouts and protein intake to maintain that.
I don't think you know much about my background, but in regards to why I trained so hard, I lost 165 pounds.
Didn't
So
know.
I have a big fire in my belly, and that's where
Yeah,
it's a priority to me. I'll make it happen, like that. That's why, and I've always said to my clients, like, I can lead by example, but don't try to be like me because it's not realistic. I own my own business. I am a health practitioner. I am a personal trainer. I have a luxury. I can work out for a living. Most people cannot. The odds
yeah,
are stacked against them. And by the
right.
end of the day, most people are exhausted. So then if I can just, and strength training is so important, but realistically with my clientele, I'm like, if I can just get you to commit to a walk every evening, help with that postprandial glucose, just get you moving. As well, what you mentioned, leg day. I absolutely hate leg day. Who doesn't? But it's so important. I always remind myself, research I saw a few years ago, that insulin resistance actually begins in the leg muscles catabolizing. So even just having my clients walk with some ankle weights, I'm at least helping them there. But it's very important, I think, for us health practitioners and influencers to highlight the fact, like, don't try be like me. My lifestyle is very different to the average person's. And we look at these Instagram influencers and they've got amazing bodies and they're doing this, that, and the other. We all want to be like that. But how? When could you be like that? You have kids, you have a house to take care of, you have a 9 to 5 job. That it's a nice idea, but it's not real.
Yeah. Yeah, you're right. So you got to budget your time as best you can and emphasize what you can. So, if you can get that heart rate up, you can limit the commitment of time to your cardiovascular approach and maintain cardiovascular health and then focus on strength training. And then I guess you're right, within the strength training consideration, don't skip leg day because it's very important. My understanding is 55% of your muscle mass is below your waist. So you don't want to ignore that. And that it's those receptors, insulin receptors on those muscles as well that are helping you lower your level of insulin resistance.
You gotta embrace the pain. No pain, no
Yeah,
gain.
yeah, I know. I'm like you though. I don't look forward to leg day, but I make myself do it, at least once a week, sometimes a couple times a week. But part of that is because, and I guess this is maybe a little bit of a good fear because of what I've seen in the emergency department. People have, especially if you're overweight up top, men, kind of an apple morphology, a lot of weight around the middle, and you've got, this big weight around the middle and then you got these little legs and it's not because you had a stroke that you can't get around anymore, but that lack of muscle mass in your legs just won't support your mobility. And that's got to be one of the biggest fears for all of us getting old, you can't get up to go to the bathroom on yourself, by yourself. You can't get out and around, or use a motor vehicle anymore. So mobility is just huge. And while you're still in your 30s, 40s, and 50s, now is the time to build a foundation of leg strength so you can hopefully continue to be mobile into your late 80s or 90s.
So before we wrap up, let's just circle back to the hormone aspect and I want to bring back in my experience again, entering perimenopause. I've been wearing this for a month now. So I've gone through a monthly cycle of hormonal fluctuations.
Yeah,
Um, Definitely more insulin sensitive. Well, all women, I'm more insulin sensitive in the first half of my cycle. My blood sugars are
yeah,
great. I can train hard because again the estrogen's on my side there. I can have the extra carbs, which I don't, but I could. But then post luteal or in the luteal after ovulation, now my insulin sensitivity goes down, and that as well was super eye-opening for me because most women don't realize insulin resistant in the second half of their cycle,
right.
regardless of their age. So I was able to see that data and be like, again, oh my God, I'm athletic. I walk all the time. I do everything right. But my insulin is still changing with my cycle because I'm a woman, basically.
Yeah.
So that was super eye-opening for me because I think, as you'll agree, when we're health practitioners, we almost think we're invincible. I'm doing everything perfect. But the numbers don't lie, and biology is going to change whether or not you like it.
Yeah, yeah. And this is one of the advantages of a continuous glucose monitor. You can wear it for 2 weeks during both those phases. You can see exactly what's going on, what your challenges are going to be at different times of month. And then if you choose to, you can correct that primarily with your dietary regimen, your fasting, and your workout regimen. So this is a natural process. It will become more challenging as we age, through both perimenopausal period and postmenopausal period for women. But again, as CGM is empowering in terms of controlling that impact of what's going on with your body hormonally as those estrogen and progesterone numbers come down.
Mhm. Here's a consideration. I'd love your input on this. I'm sure you're aware of Dr. Mindy Pels, Eat Like a Girl, her whole
Yeah,
fasting regime and everything. And I'm as much as I agree with some of what she says, I don't agree with other things, and it's causing some confusion in women because I deal in real life. I've been in nutrition since like 2008, and a lot of her recommendations are to increase carbs in the second half of your cycle because a woman's body is more stressed, especially if they're like me and they have really low progesterone. So I've got estrogen dominance, I'm super estrogen sensitive, I've high adrenaline, my progesterone's tanked. So because of that, and considering everything I know, okay, my progesterone's tanked, I'm in the second half of my cycle, I'm more insulin resistant, but I'm less resilient to stress because of all of this. So now I have to adapt my lifestyle to go with my cycle based on my specifics. But her recommendation is to increase carbs in the second half of the cycle to adjust for that higher adrenaline and the higher sensitivity to stress, to put it basically. And I get it, carbs can help with stress,
yeah,
but now we're talking about okay, we're increasing carbs to help with stress. But you're also more insulin resistant in the second half of your cycle.
right.
So how is that working then? And that's where I don't agree with some of her recommendations there.
Yeah. So I'm going to be honest with you. I'm not an expert in this area. So if I don't know something, I'll tell you. But I will come back to the value of a CGM during that period of time
Yep.
because the numbers don't lie. And the goal, no matter what, should be attempting to maintain a stable, mo low or moderate blood glucose without this variability. And a CGM will help you do that. It will provide dietary guidance. It's like the diagnostic phase of my treatment of my patients. Therapeutically, we use a CGM to see where you live to begin with. And then we use it, excuse me, diagnostically, we use a CGM to see where you live to begin with. And then therapeutically, we use the CGM to guide your diet. So the beauty of a CGM is that you can manage whatever that carb intake should be
Mhm.
because you're getting feedback as to what's going on with your blood glucose. And whether, it's higher carbs or not, let the numbers be your guide.
Yeah, the CGM is going to tell you, and that's what I learned, and that's how I manipulated things that I need to go a bit lower carb than in the second half
Yeah,
of the cycle. But what I have to do also is I have to adjust my weight training. I have to lower the intensity and the weights and focus
yeah,
more on stress management. So it's trying to find again that balance.
right.
I'm not trying to stay high carb and I'm insulin resistant, and it's just it's helping people understand because again like we said in the beginning there's information here there and everywhere and everyone's like well what do I do, nobody knows what to do. So use a CGM, track your steps, create awareness, track your sleep, track your hydration, track your bowel movements, just monitor your data and your answers will be there.
Absolutely. And again, that's why CGMs are such great tools. And I'm not insensitive to the cost, but for $50 for a couple weeks of a CGM, I mean, they can be life changing. In fact, the last chapter in my book is CGMs change lives because I had so many patients that once they see the data, this is the way they put it. Once I see it, I can't unsee it. Once I
Yeah.
see what with that particular meal, pasta or whatever is done, I can't unsee it. And this is why, again, I don't know how you lost your weight, but I am an advocate of low carb because I think it's sustainable for a lifetime. I believe something happens in your brain where you realize you just you don't even think about foods that you used to think about at one point. You don't think about donuts or you don't think about multiple pieces of pizza anymore. I really believe it is sustainable. With low carb, you can always eat something. You might not be able to eat, exactly, what you want in terms of carb intake, but you can always eat something. And so that's why, I think that this can be a very effective approach because it's sustainable long term.
There's a lot, don't get me wrong, there's a lot of dietary protocols that will work for different people depending on
Yeah,
what people are willing to do, discipline and all. But that's really the answer though, is what are people willing to do? Like,
yeah,
so it's not that I disagree. I just think people have to find like what are you actually willing to do every single day, not just for a week or two because you want results for a wedding. Like what are
yeah,
is going to work for your
yeah,
lifestyle.
yeah.
I was going to say
I
something.
just think I got to tell you, Shemaine, I just think calorie restriction is hard for a lifetime. Would you agree with that?
Honestly, it depends because I manipulate it with my clients, and I can only speak for my work and my clients. My clients have families, they have 9 to 5 jobs. It's easier for me to manipulate it where they get a refeed day each week. They can go to the cinema with their kids, they can do their baking, they can have family events. Then during the week, we do go lower carbs. Don't get me
Yeah.
wrong, I very much manipulate my clients' dietary intake based on the daily
Right.
hormonal rhythm. So I work with hormonal
Yeah.
rhythms, and they're I think people need rules. They need set rules, whether or not that's low carb all the time. But the people that come to me, they like having the flexibility of one day a week where they get
Yeah.
the fun. I'm in Canada. Things are a little different here, even compared to Ireland. Everything's different. So I work in with my people,
Yeah.
and some of them do low carb, don't get me wrong, but I've very much found for it to be sustainable, people need a break. They need the light at the end of the tunnel. And you know what, Paul, I've spoken about this is I work with people that find it hard to stay on plan for 3 days. And that's because of like stress, work demands, life demands. In Canada, the work-life balance here is insane. Like it's not like Europe and their kids are in after-school activities and they're driving across provinces every weekend. It's very unusual to me. So I have to manipulate their dietary practices. So again, my clients do go lower carb during the week, but I have to manipulate the calories so that if they do get a day off,
Right.
there are certain restrictions, but I then have to still make sure they're in a calorie deficit for the other days. So there's a lot
Yeah.
of like, it's
Yeah.
not just what people think. You're
No, you're
manipulating
right.
all the time.
Yeah. It's not one plan fits all. And you're absolutely right. First of all, even with low carb, my patients, if they need a cheat day here and there, then we go ahead and do that.
Yeah.
So, I'm actually in favor of that. So yeah, I think you're right. You got to customize the plan. And I think you brought up a good point related to what's going on in that person's lives related to the family dynamic. Because one of the things we always go over with patients is, do you have kids? How old are they? How do they eat? What is your spouse doing? Like, quite honestly, even is your spouse overweight? Are they going to be on board with whatever your approach is? So that's critical. Understanding the dynamic in the house, and quite honestly, the food that's going to be in the house is absolutely critical because you have to have a plan one way or another to address that.
And then I'm considering the age, the sleep habits, the hormones, the menstrual cycle, the whole lot. It's so
It's
complicated
a
that
lot.
people
Yeah.
think it's just one. And that's why I do use CGMs a lot with my clients because we have to do all the things. It sounds overwhelming, but it's just the way it is. I say this, I'm going to wrap up on this now, is like there's certain things we don't like to hear, we don't want to do. We wish it all was easy. You can't eat whatever you like all the time and expect the body of your dreams and perfect health. That's not what it is. At some point, you have to accept this is biology. And there's nothing you can change about it. You just have to accept it. And it is the way it is. We have to do all the things. And maybe we've been fed a few lies over the decades that you should watch Netflix and you should use skip the dishes all the time. That's not true, though. That does not align with biology, whether or not you want to hear it or not. And I'm sure you'll agree.
Yeah, I do. I do.
Well, Paul, this has been great. Thank you. Do you have any final words specifically
No.
for my women now going through perimenopause and menopause and how helpful it will be for them or would be for them to wear a CGM to help with their weight management?
Yes, I mean, I think the parting words are get a CGM, try it, try it. Just get the data, because again, I think for many people, once they see the patterns, they can't unsee it, and it very much helps with that motivation, related to how you're going to guide your diet going forward. And then of course, I'd like to make a plug for the book, if I may do that
Oh,
as well.
absolutely. That was coming
All
up
right.
next.
Okay. All right. So the book is The Continuous Glucose Monitor Revolution. It's the best-selling book on Amazon related to how to get and then use a CGM effectively. And really that's a lot of what my practice is right now in the States, since you have a few listeners in the States, more than a few, I'm sorry. I'm licensed in Ohio, Indiana, Florida, and Arizona, work with patients in all those states. And then because CGMs have just gone over the counter in the States, I also have set up a separate website for people to obtain a CGM at the lowest possible cost, along with a lot of educational materials on that website as well. And that website is cgm-doctor, cgmdoctor.com. But if you want a nuts and bolts guide, a Bible, if you will, about how to use a CGM effectively, the book again is The Continuous Glucose Monitor Revolution on Amazon, and this will walk you through how to effectively use your CGM to meet your health goals.
And that includes Amazon Canada, people. I've checked, it
Yeah,
is there
yeah, it
and it
does.
is on Prime. But do you have social media as well, Paul, that we can direct people to?
Sure, absolutely. If you go to, I primarily actually am on TikTok, and it's at DR. Don't laugh at me, okay? Don't
I
laugh.
don't even have
Okay.
TikTok.
I know. I'm better with videos than I am on, for example, Twitter. So it's at DrKolomD, at Dr. Colo MD. With that handle, I am also on Instagram, and I have a YouTube channel. You can just plug that in, or you can just put in my name, Paul Kolodzik, and you'll find me.
I'll put everything in
Yeah.
the description for
Okay.
everyone. So thanks,
I
Paul. This was
appreciate it.
great. I hope listeners, I hope you all take away like this is affordable in Canada. It's $99 over the counter, and some people will actually get it covered by AHS as well, or their doctor can prescribe. This is important. Try it out. It's 2 weeks. Wear it. You live your daily life, see the data. It's going to make a difference, especially when you think, oh, I'm in perimenopause and I keep gaining weight. There's usually a reason, and a CGM is going to help you decipher that. So thank you, Paul. It's been a pleasure. I hope you have a great day.
Thank you very much, Shemaine, for having me on.
Thank you.